website, uh, Advancing Educational Scholarship in QHS. So, here we go. To begin, I do want to acknowledge that Queens is situated on the traditional Anishinaabe and Haudenosaunee territory, and I'm grateful to have the opportunity to come together this morning on these lands and from the many different lands that we're joining from, particularly for those online, to meet as a community. As we reflect on today's talk and our role as scholars and researchers, it's important to reflect on our history and ensure that we're committed to an ongoing process of collaboration, growth, and learning. We have nothing to disclose this morning. Our learning objectives for today's session. So we're hoping by the end of the session, you'll be able to have had a chance to network with others in the educational research and scholarship space, describe the Reznick Scholar Program and the application process, and connect with 3 of our Reznick Scholars who are here today. To do that, we'll go through a few things. So some welcome introductions, the Reznick Scholar Program and application process overview, and then you'll hear from 3 of those Reznick Scholars and their work. And then at the end, we'll have some time for questions. So facilitators myself, I'm Dr. Natalie McGuire. I'm an education developer at Optes, and I'm happy to facilitate. You'll hear from me again at the end. I'll pass it over to our other presenter.
Good morning. I'm Dr. Leslie Flynn, recently retired physician from the School of Medicine.
Denise Stockley, professor and scholar in higher ed.
Hi, I'm Dr. Marian Luctkar-Flude. I'm an associate professor in the School of Nursing.
I'm Wiley Chung, thoracic surgeon, associate professor from Department of Surgery.
Hi, everyone. I'm Kim Sears. I'm a professor in the School of Nursing.
Here? Yeah, I think that sounds better. Good morning, everyone, and thank you so much for having us come and speak about the Reznick Scholar Program. It's my absolute pleasure to be here and actually particularly to think about Dr. Richard Reznick. I'm just going to give you a very brief overview of why this program was established. Dr. Reznick, and some of you may not have known Dr. Reznick, was the Dean of the Faculty of Health Sciences for 10 years, and in 2020 he was stepping down from that role. He had a long and illustrious career as a surgeon, and particularly his academic interest was in education, in medical education in particular. But during his career, he actually became very, very involved in interprofessional education. He was instrumental in many large educational initiatives in the Faculty of Health Sciences. The one that comes to my mind is the competency-based medical education program, which preempted the Royal College establishing competency-based education. That was instrumental again for our residency education programs, but influenced our undergraduate medical education programs and has been adopted, of course, across the country. When Dr. Reznick was stepping down after 10 years, we really wanted to honor him in some way, and this is how we established the Reznick Scholar Program to advance education, to continue to advance education and educational scholarship at Queen's University. And with that, I'm going to hand it over to Denise, who's going to talk to you a little bit about the application process.
Thank you. So, how many people were familiar with the Reznick Scholar Program before coming in the room? I know I can't see people online, and my apologies. So many of you. So with the selection process, what I want to talk about is, if not you, who? Meaning that if this is something that you say, oh, that's not quite me, who around you are Reznick Scholars? So the next application process, you have a long time to think about this and stew about it because the next one's not till 2027 and it's only 2025. It's every 2 years. So you have a year and a half to make friends and also to look at the criteria to say, what am I missing if I aspire to, or what can I do? The most important thing about the Reznick Scholar program is that it's actually an external review committee. When we created the program, we decided it would be external because that opens the field for everybody to be engaged without having any, intentional bias. So we have people from teaching and learning, people from research, grad studies, other places, librarians involved. I'm not going to go through line by line, although I could because I do have it here. So if you have questions, come up afterwards. But basically, this program is designed to lead to other awards. So if you are a Reznick Scholar, making eye contact, you should be looking at things like the Bailey Award institutionally. You should be looking at 3Ms and other awards as you move forward because the application process mimics those. Intentional. It was intentional when we did this. So the idea is that it is a $20,000 fund that was created, as Leslie mentioned, as part of when Richard Reznick was leaving. This funds were collected through CMO and through regular donors. And so that's the overview of the program. I invite you to come ask questions of Leslie and I about the application process, why you'd want to do it. And if you are, again, not you, then who? So let's go from there. And what's cool about as Kim and Dr. Sears comes up, we actually have Kim's part of the inaugural year of receiving this award. Then we have Dr. Marian Luctkar-Flude, who's part of the second cohort of Reznick Scholars. And then we have Dr. Wiley, Chung, who's from the third cohort.
That means I'm oldest and wisest. So, hi, everyone. Really happy to share with you the work I did on the International Certificate in Health Quality. The International Certificate in Health Quality, the purpose and vision was really to create a global platform for health quality education and leadership, was to integrate national and international leaders for shared collaboration, promote interprofessional collaboration and system improvement, equip learners with tools and implement evidence-based quality improvement initiatives, strengthen capacity to deliver safe, high-quality patient care, combine theoretical learning with experiential and reflective practice, and reflects Dr. Reznick's legacy for improving healthcare quality and education. And I had the privilege of knowing Dr. Reznick, so it means a lot to me to have this award. The International Certificate in Health Quality really focused on improving our health quality delivery, and it had 3 courses, the Foundations in Health Quality Improvement, the Internship, and the Mentorship. And we ran Ideas Here, which was a program that was put out by Ontario to schools of medicine and beyond in different universities, Queen's being one. And Ideas was a really good foundations course. It gave people an understanding of health quality, but then that was it. And so there was nothing after. So then they'd finish the course, they'd be like all gung-ho to start a project, but really didn't know how. So the thinking behind this certificate, Dr. Rylan Egan was instrumental too in the thinking of it, was to then give them something, an internship and a mentorship so that they could go ahead with their project and they'd be supported. The International Certificate, the Foundations course, really looked at introducing principles, frameworks, and methods, looked at leadership, data use, systems thinking, communication, brought through our historical perspectives, where we are and where we need to be in our settings in the future, and brought through quality frameworks and approaches to real life situation. So this Foundations course has run through OpDes already, our Office of Professional Development and Educational Scholarship. And so far, we've had 208 learners who've taken the course. The feedback, I'll just generally tell you, they felt it met their educational needs. It was well organized. The modules and tools were very interactive, easy to use. And most of them are taking approximately 13 weeks to finish this because it's an asynchronous course. which means they do it on their own, in case you're not familiar with that term. The next course, the internship, which we haven't run yet, which we're hoping to run soon, provides a supervised placement for applying the quality research and theory and practice. It's jointly developed by learners, organizations, and faculty mentors. Placements focus on system improvement and might be related to how to involve system care, but not really involving direct patient care, because that would be more of a research study than a quality improvement project. Leverages existing partnerships. So through our health quality organizations, we're part of the World Health Organization. We partnered to have internships already with our master's program with NHS Scotland and Macquarie University. So we already have some international partnerships. And the third course is our mentorship course, which focuses on building capacity for sustainability and quality improvement within organizations, prepares learners to mentor others. So the idea is you take the foundations course, you take the internship course, and then when you are done that, hopefully you would be a mentor to other students taking the beginning part of the certificate. The mentorship course emphasizes reflection, feedback, relationship building, occurs over one term to consolidate learning from previous courses. So basically, the impact and future directions, strengthens international and interprofessional collaboration in health quality, expands Queen's leadership in global experiential learning, builds professional networks and enhances system performances worldwide, and promotes sustainable culture for quality improvement in healthcare education. So why was this Reznick Scholarship so important to me? Because it, not only can I say I'm an inaugural Reznick Scholar for the rest of my life, you can put it on my gravestone if I want to, but it, there I'm thinking about age again, but it also, I was able to hire a graduate student to help me build the modules, which was awesome. We had access to the course development unit through our OpDes department, which was instrumental. So had help building all the modules for the foundations course, which are amazing to see. I could never have done that. Honestly, I could never have done that. So, and then we also had access to an evaluation, which Nancy Dargano led, which was amazing. So we were able to evaluate the certificate right away. And we had assistance because I had some funding. I was able to get some assistance with our publication that has been submitted for the Journal of Teaching and Learning through the ISOTL group. So yeah, so otherwise, without the funding and the resources, it wouldn't have been possible. So that was really a great thing to have. Marian.
Okay, so I'm here to talk to you about my project, which is about creating resources to help learners to address racism in the classroom and clinical settings. So we know that racism is prevalent in both the classroom and clinical settings, and we know this because our students are telling us this, and as well there is a growing body of literature that supports this, and it's a problem across Canada that needs to be addressed. And it's particularly problematic because of the negative impact it has on our students. It impacts their confidence, their academic performance, as well as their personal wellness. And so we had a desire to support students that are experiencing racism, as well as to support the white students that may not be aware of what's really happening, and to help them to also be able to support their colleagues who are experiencing racism. So cultural humility is a strategy that's proposed to help with addressing racism, and it's about not the cultural competence, but the humility to recognize what you don't know and that you're not the expert in someone else's culture. And it's a lifelong process of learning and reflecting on these power imbalances that exist and how they're affecting others. So prior to the Reznick Scholar Award, I had previously created some virtual simulations to promote cultural humility in the context of caring for individuals who identify as 2S LGBTQI+. And so this is the Sexual Orientation and Gender Identity Nursing series that was created with persons with lived experience of discrimination because of their sexual or gender identities. So based on that previous model, we created the Responding to Racism in the Classroom and Clinical Settings series. And so these are available open access on the CanSim website so that anybody can access them. So this is what the module looks like. And there's 3 simulations, but we start with some pre-recorded pre-briefing and pre-sim prep content that the students that were in the working group helped us to create. So there's a pre-briefing introductory module. So they're all voiceover PowerPoint type of presentations. There's one presentation on definitions, because there's a lot of definitions that keep changing. And so we want to update people on the terminology in this context. There's 2 models that are used in our simulations. One is the microaggressions triangle model, and one is the six-step approach to addressing racism. And so we had a little introduction to those 2 models before the learners do the simulations. So the first simulation is a short one about differentiating between overt and covert racism. We're trying to get away from the term microaggression because it implies that the impact is micro when it's actually not. And so these are very short scenarios that take place in a classroom setting, and then they have to try to identify if it's overt or covert racism. Ali's story is the next simulation, and this one takes place in the classroom, and it is a bystander scenario where a student notices that the instructor is biased towards one of the students in the class who is Black. And then the third simulation takes place in a clinical setting where we have a Black healthcare student, and the patient is demonstrating racism towards the student. And so throughout the simulation, they apply the strategies from those models that I mentioned to think about how they would respond to that situation, knowing that there isn't a definitive correct answer because the learner has to think about the context of themselves or the person in the situation and whether it's safe for them to try some of those strategies. And then we include some reflective questions for debriefing and some additional resources that learners can access if they want more information on a particular topic. So I'm also the co-president of CanSim, the Canadian Alliance of Nurse Educators Using Simulation, and the leader of the research interest group for that group. And so I proposed that some of the members of the group might be interested in helping me to evaluate this module. And so we had 8 sites that participated, and so it's a multi-site study, pre-test, post-test survey, and the qualitative component didn't pan out very well because we only had a few participants. So I'm only going to present the quantitative data. And so we were hoping to get a convenient sample of 102 nursing students. I actually did offer it to some health sciences students here at Queen's because that group was involved in helping to create the simulations. And so these are some of the preliminary results from 4 of the 8 sites. And so most of these participants were identifying as female women, and most were white as well. So one of the tools we used was the Ferranda's Cultural Humility Scale, because we wanted to see if the simulations would impact learners' cultural humility. And this is a scale that we've used previously with the sexual orientation and gender identity nursing. And so you'll see that the cultural humility scores did increase significantly from pre-test to post-test, but you'll see that the scores all fell within the usually culturally humble category of the scale, but they were approaching the habitually culturally humble scale or category. We also created learning outcomes assessment rubrics for use pre and post of the simulations. And so there was one specifically for Ali's story and one for Clement's story. And for both of these simulations, the learners rated that their competence to respond to racism was increased after they completed those particular simulations. So our next steps are to complete data collection at remaining 4 sites, and we actually have done that now, and we are writing up a paper on those that data, and the results have not changed from the interim analysis. The other thing we did was we created a virtual simulation for clinical instructors, because we're finding that our clinical instructors may have students that disclose to them they're experiencing racism and they don't know what to do. So this simulation provides them with some strategies for how to support the learners that are having racism in the clinical setting. And then thirdly, I received some funding from the National League for Nursing, and we're creating another simulation that takes place in the clinical setting where a learner witnesses a healthcare professional being racist towards a patient. So again, providing some more strategies that they can use in the clinical setting if they're witnessing this type of behavior and they want to do something about it. So these resources are available, as I said, open access, and so we invite everybody to access them and share them with their learners and with their faculty as well, so that they can come up with some strategies. And the nice thing about the virtual simulations is because they're filmed with real actors, the students see people role modeling how to, what language to use, how to use these strategies in real life. And that's it. Thank you.
Thank you. So my project is,
Mentioned Wiley was on our development team too.
we collaborate a lot. So my talk is from silos to synergy, mapping interdisciplinary learning across QHS. And my Reznick Scholar project really stemmed from a problem that I identified in our ecosystem, and it was really that interprofessional activities at Queen's Health Sciences have really been limited, and that's owing to several challenges, of which I have listed here 5 reasons. So the first one is there's limited cross-school participation. So most interprofessional activities really only involve 2 of the 3 schools, not 3 of 3 schools. A lot of the second reason would be the academic non-clinical programs are often excluded. So Department of Public Health Sciences, for instance, are often left out. The third is lack of protected time. So I'll use our own ecosystem in medicine, for example. Our second-year medical students really only have 3 shared sessions with programs from the other schools and 1 leadership symposium previously. So definitely not much protected time. The fourth reason is we rely on lectures a lot. And so these are really limited opportunities for growth and in-depth discussion. Most of these have not been small group learning, have not been really problem solving, and is not really conducive for active engagement. And that most importantly, there is a lack of spiral integration. So students are not given a chance to revisit these interprofessional education concepts multiple times. They see it once, they never see it again, and they never get to develop it throughout their training. And this isn't surprising, given that most curricula in programs in these different schools are developed independently without interdisciplinary collaboration. So this naturally creates silos, and it leads to curricula that has IP activities really patched on and not weaved in, as it should be. And so the focus of my initiative was really to facilitate collaborative curricular reform in our faculty of health sciences and to really weave IPE in at the grassroots rather than patch it onto existing curricula. And the hope is that by learning and discovering together, that our students and faculty will better serve our patients in the long term. When I designed my project, I ensured that there was alignment at multiple levels at our institution. So I aligned it with our REACH committee's terms of reference. And for those of you who don't know what the REACH committee is, it stands for Radical Education and Collaboration in Health Sciences. So we are a group that come together from different schools to really foster IP development across the institution of Queen's Health Sciences. I wanted it to be aligned with our strategic plan for radical collaboration, which mandated that 20% of our curriculum and programs was interdisciplinary by 2026. And it was also aligned with our first strategic goal in our university strategic framework. And so the purpose has really 5 main things. The first part of my initiative was really to map the current landscape of IP activities. So I wanted to find out exactly what activities were happening across all our undergraduate, graduate, and professional programs, of which there are 32. And not only did I want to find out what activities was happening, we wanted to find out the quality of that IP activity. So how much of it was learning with, how much of it was learning from, and how much of it is learning about. And then we wanted to determine which programs were interested in expanding their IPE activities and specifically which activities and with which programs from other schools that they would like to partner with. The fourth thing was I wanted to identify key barriers and facilitators of IP activities being successful. And lastly, the whole point of all this was to really develop actionable recommendations and create partnership opportunities to help achieve our mandate of 20% interdisciplinary curriculum by 2026. And so the way we launched our initiative was we launched a survey, and this isn't a usual survey where it's on paper or on Qualtrics. This was a survey where we ensured that it was collaborative, because we understand that IP efforts are usually conducted by multiple people from a program. So we, at minimum, had a program director and 1 or 2 IP champions from each program. This survey was bi-directional. So not only were we extracting information, we were also trying to give back at the same time. So the whole effort of the survey was to produce a report at the end. So in the future, if there was mandatory reporting around IP activities, that we could produce something that was easily accessible, that they could deliver to demonstrate the current landscape of IP activities within their program. Our Qualtrics-based survey was really 3 parts. Part 1 was background information about the program. Part 2 was understanding what existing IP activities were happening, and we wanted to know which programs are happening within their school, which programs were collaborating with other programs within QHS from other schools, and how many programs are collaborating with people outside of QHS in other programs, for instance, from the business school or engineering. And part 3 was understanding the opportunities and interests that were available. And so we are in the very preliminary stages of analyzing our data, but just take, for example, here, for our data from learning about programs from your own program with another program in another QHS school, we know that the number of interdisciplinary experiences, there's quite a lot for nursing compared to the other schools. We also dove deeper, and on the right there is a heat map that I created to help demonstrate the kind of depth of information that we were able to gather. So if you look in the y-axis, that shows the school, so medicine, nursing, and rehabilitation therapy. And then on the x-axis, it shows you what we were able to collect. So we know which activities of these IP activities were physically co-located. We know which ones were virtual. We know which ones do have active engagement. And we know which ones have learning from and about. And within each learning from, we know which one has been bidirectional and which one has been unidirectional, and the same for learning about. And through our analysis of our data, it's quite obvious that there are some exemplars that have really emerged to be strongholds for IPE. One is the IPE sessions, and the second is the Queen's Masters of Health Professions Education Program. And the reason why these have really been strongholds is because everything has been weaved in from the beginning in terms of the design of either the course or seminars or the entire program. So if we take, for example, the sessions were designed with collaborators from each of the clinical programs, OT, PT, nursing, and medicine. And so the learning objectives would be designed together. The curricular design would be designed together, instructional design, etc. And these courses, these sessions would be taught together as well, with cases that were that had components that were that allowed the collaborative sort of development of our students to happen, and the debrief was also facilitated with people from each discipline. The MHPE program was very interesting in that it was designed the same way as our IPE sessions that we just talked about, but it was the entire program. So as you look here at the honeycombs, each of these major domains have been designed in the exact same way. So IPE is naturally weaved into the entire program from A to Z. And that was very interesting to see, because I'm sure it was tons of work in the beginning, right, to include IPE and to be thoughtful about it in intentional design. But it really became effortless towards the end, in that IPE just felt natural, and it was just ubiquitous throughout the entire program. It was quite obvious, myself being a learner in that program, how it really fosters your growth in the way of your thinking for collaborative practice. Now, the part 3, we were able to gather some information. So these are some activities that some of the programs are interested in building with other programs. And so there's global health topics. Some programs are interested in building a social determinants of health course. Some wanted to collaborate to do an infection prevention and control program. And the chart below just goes to show you that for each one, we're able to dissect out who it is that wants to build those programs together. So if you look at infection prevention and control program, and you look at the bottom there, the very far one on the left, you're able to identify that nursing, public health master's program, and physical therapy master's program, we're interested in building that together. If you look at global health topics, you could see that there are many programs, over 10 of them, that wanted to build that together. So what are we going to do with all this information? The hope is, in the spring, we are going to host an interdisciplinary curriculum workshop. This is going to be a half-day facilitated session that's going to bring together program directors, IP champions, and educational developers to review our data that we're able to gather, to discuss shared needs, gaps, and opportunities, and really prioritize which areas we can collaborate on together, and focus also on the system level areas for collaboration. And of course, we're going to use that as a vehicle to launch a matchmaker initiative. And so with the information from those tables I showed you at the end of who's interested in what, we are going to use that workshop to connect programs that are interested in building something great together that's collaborative. So it's nice because we know they already share similar goals, and we're going to connect them so they can co-design new interdisciplinary learning experiences together. So we're hoping this will form working groups that will really create concrete deliverables, such as maybe a combined course, a lab, some simulations, or any other shared activity. And of course, I wanted to give credit to everyone I worked with. And one thing I wanted to emphasize was one of the wonderful things of the Reznick Scholar program was the resources that it plugs you into, in terms of, for instance, you're connected with the Office of Professional Development, Educational Scholarship. Dr. Leos, Dr. McGuire, Dr. Delgado have been instrumental in really helping me carry this project forward, identifying gaps of where I would need help, people in my ecosystem that could help move this along. So it's been really great. And also it gives you a lot of agency and a lot of growth and development in your academic career. So for myself, it's really accelerated my development. It's given me many, many opportunities that led to other things, such as many students from different ecosystems that have been able to help me move this project along. Mujidat, Julia, Christian, and Luca have all been from bachelor's program, the health science program. They've really been able to be very helpful to move this project along. So it's I learned today that it's been intentional by design, and it's really quite obvious because I have the experience. I didn't know that this was all part of it, and it really works. And I'm very grateful and thankful for the program. Yeah. Thank you.
All right. Thank you very much. I'd like to give a big hand to all of the presenters. Thank you. So thank you to Dr. Flynn, who told us a little bit about Dr. Reznick, who he was, and the inspiration behind the program. Thank you to Dr. Stockley, who told us about the application process, and 2027, why not you, is the message to take home. The 3 different Reznick Scholars from the 3 different cohorts. Is really exciting to hear about your work and the different phases that it's in, and kind of the resources that this program can bring. So thank you. Specifically Dr. Sears about the health quality certificate, the 3 courses, foundations, internship, mentorship focus, and supporting the abilities to complete, or of individuals to complete those projects. It's really exciting. Dr. Luctkar-Flude, hearing about the racism virtual simulation program for clinicians and students, open educational resources. So we can all check those out after the session if you haven't already seen them. And Dr. Chung, the mapping interdisciplinary across QHS. So diving into the curricular maps and the mess of all the different programs and playing matchmaker. I'm really excited to be part of the work and see where it goes. I think Dr. Reznick would be extremely proud of the work and the impact that all of you have on health education. So thank you. And questions. So I'm going to give you the microphone box and you can pass it around if anyone has questions from the crowd or online. Not yet online. Oh.
If anyone wants to apply, is there a website, or how do you apply?
There is a website and there is a call that goes out prior to the announcement. So also to see what other people have done under the OpDes website, you'll actually see all the different projects. I was just looking up because I know 2027 seems like it's really far away, but there is the Principals Curriculum Development Awards that is due in December, early December, like in 2 weeks. I was just trying to get a deadline. So you don't have to wait in order to do exciting things. There's always opportunities, but there is a website. The call is constantly revised based on where we are and how we do it. And as you notice, it is interdisciplinary. We've had people receive the Reznick from each of our 3 schools over the years. And I can answer any questions.
My question's for Marian. I'm always curious about CanSim. It's as I understand, sort of rooted in nursing, but listening to Wiley's talk, what interdisciplinary efforts are CanSim involved in?
Hello? Okay. Yeah, so it is founded by nurses, and the rationale was to support nurses to create shared resources because nursing didn't seem to have money when we needed it. So, but we welcome interprofessional collaboration. And actually I'm doing a workshop right now online, and we have participants from dentistry and pharmacy. And so we're always trying to bring in the interprofessional focus into any of the simulations that we can. So absolutely, we welcome, and collaborated with Wiley and others from medicine as well to bring in those perspectives. So you can be a CanSim member if you're not a nurse. And actually, I will give anybody from Queen's a free membership because Queen's has supported the work I'm doing. So I don't expect someone to pay unless they want to support the organization.
Any other questions in here online? Karen, is there anything? Not yet.
This isn't a question, but I just wanted to say the Reznick Scholars do meet a couple times, 2-3 times a year. And I've been lucky enough to be in those meetings, and it's a very supportive group who seem to become very close over the years and support each other and help each other with their work if need be. I that's one of the perks that being a Reznick Scholar.
Maybe my question's for Kim. Maybe you don't know the answer, but I'm going to ask anyway. The online foundations course, quality improvement, you had quite a few responses I saw. So there must be a fair number of people taking it. Do you have a sense of who's taking the course and why?
It's a lot of organizations are sending their people. So like they might send a group of 20 from one organization, and it's really to build capacity. Because what we found with our health masters in healthcare quality program, we initially started taking in the 20s to for enrollment, and then bumped up to 60 because it's capacity. It's going back to an organization being the only person who's involved in quality. You know, quickly you don't have support, and your projects don't get moving. So it's all about organizations sending 20, 30 people so that they have a cohort of people that can really advance quality within their organizations. And it's really nice to see it taking off, and, you know, from our masters and now the certificate, people are coming up and saying, well, we did the masters. We have a cohort here. We have a cohort from the certificate as well. So it's really great to see. And, you know, we need to advance our safe systems for all our graduates, from all our programs, from all our patients, for all, you know, it just keeps going. So yeah, it's great. Thank you.
Any other questions?
Exciting. True. So I have a question for each one of you. So what kind of buy-in did you get from your respective home departments? And if you were to offer any advice to a future Reznick Scholar, what would it be to increase the buy-in from your home discipline?
I don't think put me on the spot here. I got the letter signed, and that was about it. So it was kind of off the side of my desk that I did it, but it was, I got a lot of buy-in from OpDes, a lot of support. You know, as I said, I was able to hire a graduate student or a Posabon. I was able to do a lot, but the department, I think, was supportive, and we're happy I got it, but yeah.
So I come from the Department of Surgery, and so they've always been very supportive of sort of my academic development. But I would say getting the Reznick Scholar has really almost legitimized their, you come from the world of business, you would say it has given them a great return on their investment, because they're like, well, I invested in Wiley, and I was like saying, hey, look, I was able to deliver with this, and it almost allowed them to justify continuing to foster my development. So I would say it really, they've always been supportive, and it just really helped in terms of securing future resources for me.
Yeah, so I think the school and the director were supportive. This line of research was already part of my program. It was just an extension. So I don't know that anything was different after that, except, you know, working with other colleagues has opened up new opportunities as well. So that's been a great thing. And just having the funding, I paid all the students that participated as research assistants for their time. And this was over an extended period, because the topic, when you're dealing with racism, you want to get it right? Like, and so we took a lot of time, and of course, everybody's busy and trying to find times when people can meet. So it did take a while to develop the simulation and then to get it peer reviewed by additional EDI experts and that sort of thing. So the funding was valuable for sure.
I have a comment to make. I can't tell you how absolutely impressed and happy I am to have heard this this talk today, to hear the results of 3 of the people who have been fortunate enough and well established enough and enthusiastic enough about medical education to actually be recipients of the Reznick Scholar. I should have said at the outset, which I didn't, one of the things that Dr. Reznick was so adamant about was needing to fund educational research. There is so little finance available for educational researchers, and that was the reason for actually creating the fund. And I didn't mention that CMO, the Paul Helliwell, and alumni funding that came to support this program, which we're very grateful for. This is so lovely because it actually demonstrates that it's effectively, successfully implementing and delivering what we'd hope for the Reznick Scholar. I want to congratulate the 3 who are here today and thank you very much for the work. And as Wiley said so nicely, it actually just generates more work and more opportunities, which is great for an academic center, but also brings in new learners and excites them about the future. Thank you so much.
Thank you. And I just want to echo that. And also to go back to your question, Rosemary, about how it's received. Before we even launched the Reznick Scholar, we worked with the then directors across the schools because there's no point in introducing something if it falls flat on the people who actually matter. And this is part of the reason why we went for an external review committee, because again, it adds that cachet or that level. And when we say external, it's not, some random that's, a buddy of Denise. It's, the head librarians. It's people who have, director or higher roles who are adjudicating. So it was very intentional in the design, but intentional to make sure that every school knew that they should be encouraging. So if you're not getting forwarded emails, look in your junk, basically, because the idea is that we go to that director level to say, at the vice dean level, depending on your school, to say this matters. And it matters because this is how we celebrate and honor our own in order to do amazing things. So it doesn't mean that the next directors down the road who we don't know yet, we don't have to really encourage and support them to drink the Kool-Aid, but right now they do.
Questions? No. I don't think we have anything online yet. So what I'll do is I'll move on and give us a little bit of time to mingle. But before we do that, scan this, please. And I think we'll try to send the link in the chat if we can for those online, if you can't scan it. And this is just the evaluation of today's session. It also gives you your continuing professional development credits if it is an accredited event. So you'll get a certificate emailed to you after completing this. And folks online, I'll post the link in just 1 second here. We'll also send out, I believe, a reminder email. So if you have not yet, for those in person, just make sure you sign the sign-in sheet on your way out. And those online, we'll make sure we kept track of you. So I'm having trouble with the link, but we'll get it to you one way or the other. That up, I also want to highlight our upcoming rounds. So Tuesday, January 27th, we are switching from Thursdays to Tuesdays in the new year based on the feedback we collected in our September session. We think there's a few conflicts on Thursdays with other departmental rounds. So we're hoping we can avoid that. So it will still be at the 7:45 to 8:45 time. It'll still be hybrid, so we'll do it on Zoom and here in person. Tuesday, January 27th, we'll hear about practical uses of AI in education scholarship and education. On Tuesday, March 24th, we'll hear about building interprofessional curricula in QHS. And on Tuesday, May 26th, interprofessional simulations in educational scholarship. And then we'll release the upcoming dates for the next academic year later in the spring. All right. And with that, and maybe one last final round for all of our presenters and a big, big thank you.